Good afternoon and welcome to Ask the Expert with Dr. Walter Tom of Dr. Tom Cosmetic Surgery. Dr. Tom has offices conveniently located all over the place in Santa Rosa, in Napa, and Maui. You can also find him any time of the day online at drtomcosmetic.com. drtomcosmetic.com. You can also call at 707-542-8346, 707-542-8346. Dr. Tom is voted by you the best cosmetic surgeon for 8 years and the best esthetician for 3 years. Now is the time to nominate Dr. Tom and his team again for the best of list by the Press Democrats. So head to the PD and do that. Today is going to be really fun because Karina, who you have heard many times here on the show, has had a promotion. She's the new surgical liaison, and she and Dr. Tom are going to discuss the surgery consultation process in today's show. Hi, guys.
Hi, Michelle. How are you?
I'm good. I'm so excited to hear about the surgical process because I think it's very interesting. People want to know, right?
They do, and they want to know what's the first thing we do. And again, we have Karina. Thank you, Karina, for being on your show. Thank you for letting me be on your show, the Karina and Dr. Tom show. It was sort of, boy, what a beautiful day.
Yes. Absolutely gorgeous.
I love this.
It's so
you
nice.
love Sonoma County, period, but then be here during the springtime is beautiful.
Yes.
And we thought we saw Michelle's doppelganger.
We did.
We were driving in from our office on Stony Point Lakes, and we were driving up here at Mendocino Avenue.
Yeah.
Who was it that we saw up there?
Just this girl. She had a cute little pink bucket hat, cute little pink skirt, the beach cruiser that was nice and purple.
A beach cruiser was great. Yeah.
It's my twin. It's my long lost separated.
So Michelle not only is our producer, does the news here on KSRO, but she's out there in the world spreading love and joy. So yeah, thank you, Michelle. So yeah, great. Congratulations,
Thank you.
Karina. You are our new surgical liaison. So tell me, how did you start in the office?
I started as a patient, right? Came in as a patient,
Yeah,
and then I got hired.
Okay, and you got hired.
And medical assisting, and your medical assistant, to be specific.
Okay, I like that.
Yeah, and then you trained me in surgery, so that was great.
So you're a medical assistant,
Medical
and you
assistant.
are a surgical assistant.
Yes, and then I kind of just go everywhere you go, Maui, Napa.
You go to Maui. You got a good gig going
Yeah, I
on
think
here,
so.
don't you? Okay, so you come to our Maui office, you come to our Napa office, and so you have now taken over the surgical liaison position. You got a promotion. I want to thank Dion Foster Burrows, who has been our practice administrator and surgical liaison for 8 years, and she's now retired from the industry. And we have Karina, who, what better perfect person than somebody who actually knows as much about the surgeries as I do in the office. So thank you for taking this position.
Thank you for trusting me.
Absolutely, 100%. So, Karina, today what I wanted to do is to actually help our patients and our listeners go through the process, as Michelle Marquez had mentioned, about, what do we do? We've been thinking about it, and as you know, patients usually think about a cosmetic procedure for a long, long time, right? And it takes a lot of courage even to make a phone call, right?
Of course.
Okay.
Yes.
So if they have questions about cosmetic surgery, if our listeners have questions, we just walked through KSR right now, and we're not going to mention who, but somebody had a question about something, and you went over and you chatted with them. Tell me, how do they start? What should they do?
Just call us. You heard it in our intro. Call us at 707-542-8346. And then anybody who answers will know where to direct you.
Okay.
And if you want to talk about surgery, they'll say, oh, we'll get you in touch with Karina.
Okay, so they're going to call and they want to speak to you about maybe some concerns, whether it's cosmetic. And so for our listeners who don't know what we do cosmetic breast surgery, so that can be reductions, it can be lifts as well, and of course augmentations. We also do fat grafting, so we do facial fat grafting. We also transplant or transfer fat to other parts of the body with liposuction or SmartLipo. We also do upper eyelid blepharoplasty. We will do in certain situations tummy tucks for body contouring, and of course where we all got started with leg veins, and we take care of that as well. So Karina, when they call, will they be able to get right through to you? Do they need to make an appointment? How does this go?
Well, it just depends. If I'm available, then they'll come and grab me and I'll hop on the phone. But usually they'll take your name and phone number, a good callback number, and then I'll get back to you. Usually I try to get back to patients within a day,
Okay.
just so that they know that I
Right.
heard, I got your, let's touch base.
Right.
But usually within the next 2 days, they can get a hold of me.
So, yeah, to our listeners, everybody's busy, and let me tell you, as much as I love Karina and I work her really hard. Okay, so she's working in surgery with me. We're seeing our pre-op patients. We're seeing our post-op patients together. She's assisting me with medical cosmetic procedures. So she may not just be readily available when you call at 2:30 on a Thursday afternoon. So what we'd like to do, Karina, if the patient's willing, we'll get their phone number, and I know you call them back. And in fact, half the time when I can't find her, she's gone into, we have our administrative room. What do we call our administrative room?
Think tank.
Our administrative room is called the think tank, exactly. So Karina sneaks over to the think tank and she's trying to get in touch with our patients, but of course, you're busy as well. So what we are now trying to adopt is to actually set you up for a formal appointment, phone appointment with Karina. And usually, how long does it take that when you're talking with patients?
It can be a 20-minute conversation depending on how many questions they have. Sometimes a little bit longer, but yeah, that usually gets me enough information.
Okay, so 20 minutes, and I'll have to tell you that I think that she's being a little modest. That Karina, half the time, like, where's Karina? And it's because she's on the phone, and I suspect that you spend at least half an hour,
Maybe.
45 minutes with the patients,
Yeah.
and you're answering their questions and concerns. And so if you're interested, please call our office at 707-542-8346. And what we can do if Karina's not readily available is they will have her schedule, and we can set you up for a specific time so you know that she will be calling you, so you're not playing phone
Right.
tag. Because I know that
We
can
play
be,
phone tag a lot.
you play
Yes.
phone tag a lot, and it can be very frustrating for our patients, and of course frustrating for Karina because she wants to get in touch with you to talk. Okay, so they call and they have questions about this. What kind of questions are the most common questions that they have when they're calling you?
You would think that pricing is the first one they ask, but that's not even the first question that's asked. It's what's the downtime? When is your next availability? What is the procedure entail? All those details that people think of when they're calling. Yeah.
So interesting that you would say that the first question isn't about price, because it can be, and we understand that. I mean, economy's tough right now, but it's interesting that some of our medical treatments, in terms of just because of the economy, have gone down a little bit, but surgeries have actually not. So it's my feeling that people, once they make a decision that they want to do some type of self-improvement procedure, that they're pretty determined. So they don't ask you about price first of all, though. Will you share the price with them?
Oh, yes, of course.
Okay.
Yeah.
So you share the price with them, and my only caveat would be is that Karina is not the surgeon. Sometimes she thinks she is, but she's not the surgeon. And so, we have to evaluate you. And then when we can finally decide on what really needs to be done with you, that fee quote might be altered some, usually not a lot, but a little bit. And so it might be down, it might be up, but it will give you a ballpark figure. So they will sometimes ask you about price, but it's interesting that the very first comment that you made, or question that they may make, is what's the downtime?
Yes.
So what do you think is their concern when they're asking that?
I think people are busy. They have their own lives, kids, events, sometimes weddings or stuff that they're trying to plan this around.
Right.
And they want to know, how long am I going to be down for? It is cosmetic, and we do it under local. So some people think, oh, it's an expedited recovery. It's not. It's still a surgery. Even though you feel great after, sometimes it's still a surgery. So that's important for them to know. Yeah.
Thank you for saying that, and I know that Karina personally has shared with me when she was our patient. You were a medical assistant.
Yeah.
You actually worked for a colleague of mine. I feel bad we stole her away from my colleague, and that she and you went through this. And you have actually told me that you don't feel like you set yourself up mentally in terms of what I should be expecting and what to do, even if we may have told you that. So I know that educating our patients is really important to you. So they're concerned about The downtime. Now, I do think that under local anesthesia, your downtime is dramatically improved, but you still have to take care of yourself.
Correct.
Okay. If you don't allow yourself time to heal, you're going to actually slow your recovery.
Yes,
So
absolutely.
I appreciate that that you mentioned that. And then they ask about the procedure. So what do you tell them about procedures?
Just depends on the specific procedure that they're inquiring about. You know, let's just go with breast augmentation. That's
Okay.
one of the most popular ones.
Sure.
They want to know, you know, what's silicone versus saline, what's, you know, what is better for me. And some questions I can answer, and I'm happy to, but some I say, you know, that's a great question for Dr. Tom when you see him for your 60-minute appointment consultation via Zoom. So if I ever think they need a lengthier explanation, or you know, something that it's out of my expertise, then I let the real expert
Okay, got it.
talk
Okay.
to them about it.
All right. So if you listen to Karina carefully, you notice what she does is she saves the hard questions for me.
Yes.
She answers the easy ones and takes all the credit for it, and then she gives me the tough ones. No, just kidding. But what I really like about what Karina has just mentioned is that she's spending time with you, trying to answer your questions. And the advantage that you get is that Karina is not only our surgical liaison, but she's assisting in surgery. She sees the before and after care is being instituted for you as a patient. And she also has the perspective of being a patient, so that she is a great surgical liaison for questions that you may have. You also mentioned that you set the patients up for a Zoom meeting with me. So,
yeah.
you know, that's going to be 60 minutes. We actually set aside, believe it or not, 60 minutes for me to talk to our patients on there. So do they just get on a Zoom meeting, or do they have to do anything to set up the Zoom meeting?
No, yeah, we will set up an appointment. I will email them forms, and we request some photos beforehand for you to review. That's always important. And I'm trying to give our patients, you know, because we're all busy, a 3-day time period, business day, please get these back to me within 3 days, because you know we need them as well for you to review.
Right.
And after that, then they receive their Zoom invite, or Zoom invite from you. If we want to do in-person consult, can be done. I usually ask you.
You
can we do this in person? And
Right.
some occasions we do need to see a patient in person.
So you covered a couple of important items in your answer, Karina. So one was that you're going to be sending them information, and so there are forms, and some of them are the typical office forms. Some of them are important in terms of you writing down your medical history for us, so because this is still an operation and we want to know that you are medically appropriate for what we can offer you.
Right.
So that's important. And then just some operational information so you know what to expect. So we set them up, as you said, probably 95% of the time for a Zoom consultation.
Yes.
Okay,
Yes.
and that's 60 minutes with me. And so it's important that I get your photos ahead of time, and Karina will tell you what kind of photos that you are to send. And I have to tell you, when we instituted the Zoom consultations during the COVID pandemic, and I didn't like the idea of doing this. I always felt like I want to meet the patient, shake their hand. I want to be able to examine them and to be able to bond with them one-on-one, and that was really important to me. And because of COVID, we had to move to a virtual consultation. And now I have to say that I feel that a lot of patients feel more comfortable doing it that way, because it can be intimidating to come into an office, and also to get disrobed, for instance, depending on what we're looking at initially. And so patients actually feel more comfortable, and they send it to a secure email, your email, and then that's shared with me and protected by HIPAA, and we do have all those precautions. So that patients actually feel more comfortable sending in photos, and that surprised me, but they do. And so we set it up, and it's important for me to be able to look at these photos so that I can see, number one, if you're a good candidate for what you desire and what we can offer you, because we want to meet your expectations. The other thing is that if you don't, then we don't want to waste your time, and we can then refer you on to maybe a more appropriate type of technology or office that fits your needs. And so that's important for us to get those photos, and I appreciate you doing that. The other is that this is just like doing an in-person evaluation. Usually it's just me. We're not having you disrobe on the virtual Zoom meeting, so that's why we look objectively at the photos when I share my screen with you. And for post-op, sometimes especially when we have a Hawaiian patient, a Maui patient or something, Karina is actually on the Zoom call with me, so we're always making sure to make the patient feel very safe and secure. And I think Michelle had a question.
I do have a question. This is about the photos, because I know when I've asked, not in your situation, but when like I do art and I ask for reference photos of someone that I'm doing a picture of, it's really hard because they just like take a little picture and like I can't see what I need to be able to see for, you know, what I need to draw. So how much, you know, information do you give or instruction do you give on lighting, like position of the phone, like when you're taking a picture, like those kinds of things?
Yeah. I actually have started giving some direction. I say, you know, if someone can take it for you, it's awesome. If someone can take it for you, and I usually say no face in the photo. You know, from your neck down is important. And then I've also told patients, if you can put your phone on a selfie mode and do a timer, iPhone, prop it up somewhere, it's a little bit easier. It gives you time to be able to take those photos. And again, if you're worried about the concern about your face being shown, then neck down and waist up is usually good. And if we're doing body photos, then, you know, sports bra or a bathing suit, that always works out great too. Yeah.
Right, so so great question, thank you, Michelle. So you will get directions on how to do this, and normally we're looking at multiple views. We're looking at straight on, at an angle, we call it a oblique angle, or 45 degrees, and then a 90 degrees, so we see a side view. So we will give you the directions, and I should say that Karina will do this, and set you up for our consultation. Okay, so Karina, as we're kind of looking at this, and you had mentioned that, you know, patients don't usually ask you the price, but there will be the occasional patient where that's their primary concern. And again, I'm just going to get on my soapbox for a second. And I think that our price is actually extremely competitive. We are very, very competitive and good value for what we deliver for our patients. Having said that, really you want to go to someone that you like as a person, okay, that you trust, that is qualified, okay, and will follow through. So do you get a sense that they will follow through with you if there's an issue or a problem? And then, of course, cost. You don't want to make it just based on cost, but people will still say, oh yeah, Dr. Tom, okay, how much does it cost for a breast augmentation? Right. So what if somebody just wants to know that? Will you give them that information?
I will. If they're just, you know, calling, how much does it cost? I do get those calls where I'm looking, I'm just getting all my information, and the finance is my first option or my first question. Then I do give that. And even people who don't inquire about the pricing right away, I do let them know that this is the price, but there are additional things that are not included in the price. And those would be your garment, your lab work, if you're a woman, any mammograms or any additional labs or information that we need from your general doctor. So I always let the patient know that.
So we try to be transparent, and I appreciate that, Karina. So you try to, when it comes to cost, I hate when somebody's surprised at the cash register, okay? I just don't like that. It really bothers me. So we try to be very transparent about it. One advantage of working with us, because we do everything under local anesthesia, that we don't charge you for an operating room or an anesthesiologist, because I'm putting in the local anesthesia and monitoring you. And remember, I do have a background of being a general vascular organ transplant surgeon, critical care physician, and so forth. So, you know, you're going to be well taken care of in our accredited operating room. But we are, so we are transparent about that. So we set them up, we have a consultation, and we decide that, hey, you know, maybe we want to move forward. Do just have a Zoom meeting and then I book them for surgery? What happens?
Well, in a way, yes.
Oh, okay. All right.
But they still get to see you first before surgery. So we do book an appointment prior to the surgery, about 2 to 3 weeks before, where we go over our pre and post, and they get to see you in person, measurements, all that good stuff. We have that video, we have that recording, the pre and post somewhere on YouTube, so they can watch that if they have questions.
We do, you're right.
Yeah.
Okay, so Karina was in on a show where we talked, actually we kind of went back, we went a little bit backwards there, but we, the first one I think, the earliest one was on post-op, and then we did a pre-op. So go back onto our YouTube on the Dr. Walter Tom channel, and you can find that, and you can review that as well, and that's why we're recording this particular show as well on KSRO Ask the Expert on the radio, but we're also going to be publishing it on YouTube. So you will set them up. So first of all, they get about a half hour with you. I know you say 20 minutes. They get about a half hour with you at least. Okay?
On the phone.
Right, on the phone. And then they get an hour with me on a Zoom meeting. Okay,
Perfect.
then we set them up for the pre-op visit.
Correct.
So they don't start off with me. They first meet with you, correct, for paperwork and so forth. And how much time is that with
That's
you?
a 30-minute appointment.
That's 30 minutes. And then how much time do they get with me?
Full hour with you again.
Again, a full hour?
Yeah, it is
really?
a full hour.
Oh my gosh. Okay, so we got another full hour with me. So we want, you can tell we're really dedicated to making you feel comfortable with us and educating you. So we've done that. Okay, so now we're going to kind of, and so we've gone over all of that, and now they're getting ready for surgery.
Yeah.
Does anybody call them before surgery, even though we've already gone over all of this?
Yes, and you'll get one more reminder from Nurse Heather on what to do. So yeah, we talk to you a lot.
We talk to you a lot. You're going to be so tired of us. But Heather Bronstein is our OR nurse manager. Okay. And sometimes Taryn, who's with us as well, who is our previous OR nurse manager, will cover for her. So it could be Heather or Taryn. And they will, we don't have any Janes, Jills, Sallys. We have all unusual names in our office, which is great. So they will call the patient ahead of time and review their pre-op and what to expect. So they come in, and now let's just fast forward. They'll come into surgery, and the beautiful thing is they get to see you.
Of course.
They've already talked to our nurse. Of course, they've met with me. We do their surgery. How do they follow up? Are appointments already made?
Yes. We'll make
do?
all those appointments when we schedule the surgery. So we'll make your pre and all your post and surgery appointments. But depending on the surgery, we most always see patients the day after for the procedure, or 1 to 2 days, and then 2 weeks, and then 2 months after surgery. That's our general rule of thumb.
And so we book those ahead of time so that you know, because it can sometimes be hard to get in to see us. How far in advance right now are we scheduling for surgery?
Right now our next available is in August. So we book out quite a ways, and
we're April. We're in April, middle of April, so we're booked out. So please, if you're interested, please call Karina. Karina, we have about 5 minutes left in the show here. So, you're well-spoken, you're lovely, all those kind of things, but in terms of qualifications, why should they talk to you? I mean, what are your qualifications to be promoted up to surgical liaison?
Well, I have a little joke for you.
You have a joke. This is off script, everybody.
This is off script.
Okay, what's the joke?
So I do identify as a koala, right? I'm the koala, you're the tiger. So I have many qualifications for this job.
Oh my God. Okay, so
I figured you like that.
We have these alter animals, and I'm like Tigger. I definitely am like Tigger and Winnie the Pooh. I'm all over the place. And Karina is definitely a koala. Okay, so you have a lot of qualifications. I like that. What are your other qualifications?
So I'm your scrub tech and surgery.
Right.
I am their patient's guide for before and after.
So you do the pre and post-op education.
Very familiar with what the surgery, how it goes, and then what the before and after entails to educate the patient. And then, I've been with you for 4 years, so I've learned a lot within those 4 years. And I've also been a patient, so there's a lot of personal information that I can also relate to the patient.
Right.
Well.
I think that's huge, and in fact, it makes me feel very honored and proud that a lot of our staff have been our previous patients, and in fact, we have our newest nurse, Jessica Kerr-Allen, and she was a patient of ours for 5 years. She'll share this, so I'm not divulging anything against her wishes. She shares this readily, and now she's going to be our new cosmetic laser injector nurse specialist. So we're really excited. She just came on board, and I will be bringing her on Ask the Expert in weeks to come. Exactly, it's a rite of passage. So that sounds great, and in terms of that, Michelle, do you have any other questions that patients might be wondering, like, should I make that phone call?
Yeah, I think really just like if you know that right now you're like 4-ish months out,
Right.
and then you'd have to calculate on top of that downtime or like scheduling out. You've got meetings, like all of this stuff. So timing, can a person talk over that with you and really get a realistic idea of when the surgery might happen and their downtime included in all of that?
Yeah, that's one of my questions when they get on the phone. How soon are you wanting to get this done? Or what's your time frame? Yeah.
Okay, all right.
Great. Wow.
Yeah.
Okay, so we got it covered. So you can see why we promoted Karina to be our surgical liaison. She actually has a tremendous knowledge of what we do. She'll be able to guide you in what I really love. And she puts up with me. A koala puts up with the tiger. Okay, so you know she's very patient, and so she's not only patient, but she's a great patient advocate. And so if you are interested in anything, and if you just have questions, that's okay. You don't even need to book a consultation with us. You know, of course, we'd love for you to book, and there's no getting around that. We'd love to take care of you. But if you just have questions, we have patients who have done that. They've talked to us 2 years before. They were kind of thinking about it, and then they call us and say, whatever happened to Jill Smith? And 2 years later, we get a phone call from them, and we're doing their procedure for them. So
that makes sense though, because you've talked about people thinking about it for a long time.
Yeah.
So being informed helps you just sort of like let it marinate in your brain a little bit longer, right? And figure it out.
Completely.
Yeah.
And the one thing though is once, Michelle, they make that decision, they want the surgery.
Then they're ready. Then they want it yesterday.
They want it yesterday. Exactly. So if you want it yesterday, please call us today if you want it yesterday, so that we can help you and try to expedite the process for you. Karina, thank you so much for going over all of this. It's super informative even for me. I really appreciate it. Michelle, I'm going to turn it back over to you. Thank you all for listening to us.
Yes, thank you, Karina and Dr. Tom. Please reach out to Dr. Tom of Dr. Tom Cosmetic Surgery offices in Santa Rosa, Napa, and Maui, online at drtomcosmetic.com. You can see a lot of information actually on that website. So some of the questions that you might have could be answered right on the website at drtomcosmetic.com. And then again, of course, call for that free consultation at 707-542-8346.